Plastic surgery procedures continue to grow in popularity, and with that, many people are considering leaving the U.S. to fly to other countries. They're searching for less expensive options that insurance companies typically don't cover. This growing trend is called medical tourism.
Usually people who are going abroad aren't going abroad to see the world's expert on a particular procedure. They're going to see if they can have something done cheaper.
In fact, some cosmetic procedures done abroad can be half the normal price. But consumers want to know, is it really a good idea?
It's probably a bad idea unless it's a real doctor that's well-trained that you know about.
And as we said earlier, if you have any complication whatsoever, it could end up costing you 4 or 5 times what it would have cost you if you'd have just stayed here in the first place.
So what happens if there are complications after surgery? And will patients be ready to spend more money and get back on a plane for post-operative care?
The process of surgery really encompasses a good analysis preoperatively, a carefully done operation, and very carefully performed post-operative care. To give up that last third assumes that there will never be any questions, problems, or complications afterwards. And quite frankly, I think it's naive and unsafe.
Many surgeons feel it's extremely important to stay close to home when considering surgery.
So suppose an infection happens when you're in the wilds of Africa, okay, or you're in Thailand. Now you have to fly here. Who knows about the hospitalization costs and the antibiotics. At least I think things are probably a little safer and more controlled in this country.
In addition to the risk of infection, patients need to consider the other more serious risk after surgery, such as blood clots and bleeding.
There aren't many procedures that I would encourage a patient to travel long distance right after having surgery. Just think if something happened in the flight on the way home within 24 hours from surgery. I can't imagine that that's a good idea.
These surgeons are quick to point out that there are many qualified surgeons everywhere, but you need to do your homework. Keep in mind it may be more difficult to research and find references on surgeons in other countries. So while medical tourism may sound like a good idea, in order to get the best outcome and reduce risk, it's best to stay close to home and leave the sandy beaches and exotic places for vacation.